Hello and welcome to Health Professional Radio. I'm your host, Neal Howard. Thank you for joining us today. Our guest in studio is Jane Barratt, Secretary General of the International Federation on Aging. And she's with us today to talk about diabetic retinopathy and a study that reveals that adults with diabetes are unnecessarily at risk of vision loss. Welcome to Health Professional Radio, Jane Barratt.
Hello, Neal. Good to be with you.
You as well. Thanks for joining us today. Now, you're Secretary General of the International Federation on Aging. Talk about the IFA. What exactly are you involved in other than the obvious?
Neal, the IFA is connected with the United Nations and World Health Organization, and we exist to be a global point of connection of experts and expertise to influence policy related to older people. It's a really important subject at the moment, isn't it? Because we're all aging. And we know that by 2050, there'll be about 2 billion people over the age of 65. And that's one of the reasons that we're involved in this very important study called the Diabetic Retinopathy Barometer study, because we're really at the point of a perfect storm. Rapidly aging population globally, a dramatic increase in the prevalence of diabetes, and at the same time of these complications of diabetes, eye disease, so diabetic retinopathy and diabetic macular edema. So that's why we're involved in this important study.
Now, are there things that are specific to the aging that have diabetes, or are we talking diabetic retinopathy across the board as far as diabetics are concerned?
Look, it is across the board, but what we do know is that the number of people with diabetes has nearly quadrupled since 1980, to 415 million adults, and by 2040, it's set to rise to 642. What that means is 1 in every 10 people aged between 20 and 79 will have diabetes. And that's a tremendous challenge, not only personally as an individual and the family, but also has tremendous social and economic consequences for every government.
Is the prevalence of diabetic retinopathy one of the main, fears, other than having diabetes? There are several complications associated with diabetes. Is this one of the more, feared, the loss of vision? I can't imagine, thinking that I've got something where loss of vision is a very real possibility when I don't have an eye injury.
It is the most feared complication of diabetes. Next come cardiovascular disease, amputations, kidney disease, but the loss of vision affects 79% of those in the study. Wow. And when I say, affects, not able to drive, not able to continue in employment, not able to keep a job, not able to undertake household activities. So the identity of the person changes with diabetes and vision loss. Some of the respondents were not able to manage their diabetes effectively because they had vision loss. So it is a serious complication and one which is preventable.
Now, how many people were actually involved in this study, and is this something that was restricted to just one area?
Close to 7,000 individuals in 41 countries. It is a landmark study, never been done before. We gathered evidence from about 4,500 adults with diabetes and about 2,500 healthcare professionals, because we wanted to understand the level of awareness from the perspective of the patients, but also what the professionals were doing about, access to treatment. So both of those groups.
Now, since the study, have you seen, an increased sense of urgency to get the word out about maybe some breakthrough treatments or preventative measures?
This is an ongoing issue, isn't it? Because there are so many priorities when one is growing older, and also one with diabetes. But what we do know is that people need to get to screening immediately. They cannot wait. And many people in the study didn't recognise that. We also know that health professionals need to be much more informed about eye complications, diabetic macular edema and diabetic retinopathy. And the third key message is around our healthcare systems, which, quite frankly, are inadequate for the patient in the system. And so those are the three key messages: a late diagnosis, no screening or late screening, doctors, health professionals that don't have the right protocols and guidelines, and healthcare systems that actually are not responsive to the patient's needs.
Now, there are different healthcare systems, 41 countries. Each of these countries, I'm sure, have different varying nuances about the way that they care for their citizens. How does your organization, in conjunction with those affiliated with you, work to get the education out there across the board so that everyone's on the same page?
In 2017, we are bringing together patient groups, the healthcare professionals, together to discuss what are the barriers in your country and what is the barrier that we need to address to actually shift the needle to improving patient outcomes. We're dealing with a care pathway, the pathway that a person goes through in the healthcare system that's either disconnected or disrupted. And so we've got to get the healthcare professionals, the patients, and the government at the table to understand the barriers.
Now, in wrapping up, in your experience and in talking with other healthcare professionals, do you think that the first line of defense is the general practitioner, the diabetes specialist, or maybe the eye doctor?
Do you know, any point of contact with the health professionals is the first point of contact. Okay. And that's why we are advocating that healthcare professionals across the board must be very conscious and acknowledge the essential need for eye screening. And so that's our big message out to healthcare professionals. Be up to date with your knowledge and education, and you do the asking about whether this person in front of you has had a screen, because vision loss is preventable.
Do you, I know I said we were wrapping up, but I was wondering if you felt that the role of the patient in the management of their diabetes as it relates to eye care, is that something that that education, is there just as much sense of urgency to get that education out to the patients as well as the practitioners, or are we counting on our practitioners to educate us all?
We can't count on practitioners. Our own health belongs to us. So we have to be well informed with accurate information. One of the findings from the study was the increasing trend to actually look on the internet for knowledge. And so we actually have to make sure that that knowledge is accurate and up to date. So it's patients being informed, families being informed, as well as healthcare professionals, and then governments that are responsive in their policies.
Now, where can our listeners go and get more information about the International Federation on Aging and diabetic retinopathy as it relates to diabetes?
The website is drbarometer.com, and on that website you can download the reports, global report and country reports. You can ask questions, and you can be updated as we move into 2017 with our major advocacy strategy.
Excellent information. Thank you so much for joining us today.
Thank you very much, Neil, for your time.
You've been listening to Health Professional Radio. I'm your host, Neal Howard, for this Health Suppliers segment of the show, in studio with Jane Barratt, Secretary General of the International Federation on Aging, and she's been with us talking about diabetic retinopathy and the Diabetic Retinopathy Barometer, or DR Barometer, a study that has revealed that adults living with diabetes are at unnecessary risk for vision loss. Transcripts and audio of this program are available at healthprofessionalradio.com.au and also at hpr.fm, and you can subscribe to this podcast on iTunes.